Imagine a patient comes to you with the complaints of chest tightness, chronic cough and sputum, dyspnea. What would be your diagnosis? Well, you can think of a range of diseases. For now, let's assume this is a case of COPD. So our today's topic is COPD. Chronic obstructive pulmonary disease is defined as persistent respiratory symptoms and airflow limitations caused by significant exposure to noxious particles or gases. It includes emphysema and chronic bronchitis. Now let's learn about emphysema. Emphysema is defined as abnormal permanent enlargement of air spaces distal to the terminal bronchiole associated with destruction of alveolar wall. Now, have you ever thought how these healthy alveoli converts to these ill-looking alveoli? Some factors initiate a series of events that lead to changes in acini. They are cigarette smoke, air pollution, occupational dust, biomass fuel. They causes oxidative stress, epithelial injury, impaired mucociliary transport, activation of resident alveolar macrophage, and epithelial cell damage. Resident macrophage and damaged epithelial cells release cytokines, chemokines, growth factor and reactive oxygen species. Recruitment of inflammatory cells like neutrophil that release neutrophil elastase, myeloperoxidase, cathepsin and more reactive oxygen species. As inflammation persists, CD8+ lymphocyte comes and release perforin, granzyme B, interferon gamma, TNF-alpha. So proteases like elastase, cathepsin, matrix metalloproteinases becomes more than antiproteases like alpha-1 antitrypsin, secretory leukoprotease inhibitor and tissue inhibitor of metalloproteinases. So net effects are overinflated lung, destruction of alveolar wall, loss of elastic recoil, air trapping, reduced surface area for gas exchange and impaired oxygenation. Genetic association of emphysema. At basal state NRF2 is bound to KAP1 and make it vulnerable for destruction by ubiquitination. So at basal state or normal condition antioxidant gene NRF2 is not needed. When a person smokes, oxidative stress starts. Cigarette smoke contains numerous oxidants like reactive oxygen species. This causes oxidation of cysteine residues of KAP1. KAP1 changes its shape and can no longer bind to NRF2. NRF2 becomes stabilized and goes to nucleus. Here it binds to antioxidant response element. Cytoprotective gene transcription starts. They are hemoxygenase, NADPH quinone oxidoreductase, glutamate cysteine ligase catalytic subunit, superoxide dismutase. They reduce inflammatory stress, protease activity and oxidative damage. When the toxic insult is more, NRF2 response is insufficient. Inflammatory and protease activity increase. As a result, alveolar damages occur. Types of emphysema: centriacinar, panacinar, distal acinar and irregular. Centriacinar emphysema is seen in heavy smoker. Central or proximal part like respiratory bronchiole involved. Mostly upper or apical lung segment is affected. Panacinar emphysema involves person with alpha-1 antitrypsin deficiency. Aggravation occurs due to smoking. Whole acini-form respiratory bronchiole to terminal blind alveoli is affected. In case of distal acinar emphysema, distal part of acini and upper half of lung is likely involved, while in irregular emphysema, irregular involvement associated with scarring presents.